A second, we should be good.
Good evening. I'm Gary Christensen, Mayor of Malden, and tonight I come to you from the Malden Senior Center, where we are faced with the biggest challenge of our time. But I'm here, we're here, to let you know that we will make it through it. And how we're going to do that is by working together. And so, as difficult as these last few days have been, I do want to say it's also been refreshing to see the outpouring of support from our community to come together to fight this disease. Just the other day, Piece of Pizza called, wanted to offer food to our elderly and students who are in need. Encore Boston Harbor, despite them closing, one of the first calls they made were to Malden to see if they could help. Cornucopia has expanded their deliveries. And then from our staff, Superintendent O'Teary, our custodians, food services, our assistant principals, rallying together to provide food while school's out. And then, of course, I just can't be more impressed with our staff here at City Hall. They have been on top of this since we first learned of the severity, and they wanted to be here with me tonight to try to answer as many questions as we can, and to also talk about what we expect to happen moving forward. So tonight we're joined by Glenn Cronin, the director of our emergency management team. We have Chris Webb, our public health director. To my left, we have Ron Hogan, who has really led the effort on making sure that there is a continuity plan for our government. And then to my right, we have Karen Cologne Hayes, who has really been our point person on making sure that people have access to services. And then to my farthest right is our state senator, Jason Lewis, who along with the delegation also contacted Malden right away to see what they could do. And he's going to provide some insight as to what's happening at the state and even the federal level. So with that being said, what we're going to do first is have each of the panelists just say a few words about what's happening in their respective realms, and then we're going to do the most important thing, which is to get to your questions. We're also joined tonight by our superintendent, John O'Teary, who's phoned in from Melbourne. So he'll be on the phone as well as a resource for, I know, the many questions that we have around the school system. So without further ado, let's first hear from Public Health Director, Mr. Chris Webb, and he'll be followed by Glenn Cronin, our Emergency Management Director.
Good evening, everyone. It's been a very trying period for everybody, I'm sure, but I really can't say it strongly enough that hang in there. It will get better. It's going to take time. It's going to take a concerted effort, and it's going to take people looking out for one another. So watch your neighbors. If they need help, make sure you can give it to them, all the while keeping social distance in your back of the mind at all times. As of today, the city of Malden has 56 cases of coronavirus. 3 contacts are confirmed, added today, so that makes it 59, and 2 positive cases as of today. So the disease is here, and so far from what my inspectors are telling us today, the stores, the retail food stores and the restaurants are doing their part. So please do yours and come back when everything's ready to go and support them as best you can.
Okay, now let's hear from Mr. Cronin, Emergency Management.
Good evening, everybody, and I want to say happy St. Patrick's Day to everybody. My name is Glenn Cronin. I'm the city's Emergency Management Director. I first want to thank Mayor Christensen and his staff for their never-ending support and guidance during this health crisis. I also want to thank you, our community, for your cooperation and understanding during these difficult times. I'm just going to briefly discuss emergency management in general and how it intersects with the coronavirus, and then my role as the Emergency Management Director. To give you a little background on the emergency management team itself, we have 6 members. Our communications director, Mr. Ron Cochran, represents the mayor's office. The Board of Health, represented by Director Chris Webb. The public school system is represented by Mr. Peter Dolan. The fire department is represented by Chief Bill Sullivan. The DPW is represented by Mr. Bob Knox, and myself representing emergency management. I'm going to just talk very briefly about the 4 core principles of emergency management, which are universal. These are mitigation, preparedness, response, and recovery. In the context of an infectious disease outbreak like the coronavirus, when we talk about mitigation, what that is our efforts to communicate to the public, to get the message out there on what people can do to protect themselves and their families from contracting and or spreading the disease should they contract it. We receive all of our prevention measures from the CDC, the Department of Public Health, and our own local Board of Health. The next step is preparedness, and what has the emergency management team done to prepare for a situation like this? We have participated in 3 tabletop exercises in the very recent past that included our regional partners in emergency management, Region 3 Health and Medical Coordinating Coalitions, EMS, fire departments, and police departments. These exercises utilize an all-hazards approach to training, meaning we train for a wide variety of hazards, whether they're man-made or natural. And of course, an infectious disease outbreak is one of them. So we are prepared for whatever comes our way. The third phase is the response phase. Right now in Malden, we're still in prevention mode. If and when we begin to experience community-wide spread of confirmed cases of COVID-19, we will then go into a containment phase. We would then initiate the National Incident Management System by way of ICS, which is otherwise known as the Incident Command System. The Incident Command System is a standardized on-scene emergency management system that is adaptable and scalable from the smallest events up to and including very large complex incidents that would involve multiple agencies, multiple disciplines, and multiple jurisdictions. It's basically an overall management tool to control your resources, equipment, and personnel. In my own personal opinion, I don't think we will get to that point, but if we do, and we will need to open up an emergency operations center at that point in consultation with the mayor's office, the emergency management team, essential city departments, we would open up an EOC that would work in conjunction with the JOC, which is a joint operations center, which would be our local partners in the state. One more phase is the recovery phase, which is often an overlooked phase of emergency management. The response phase sometimes bleeds into the recovery phase and they become indistinguishable from one another. An example of recovery efforts include preventing and or reducing future outbreaks on what we currently learn right now. It can also be, as I said before, a continuation of the response phase. But most importantly, it's going to entail us communicating with our state and federal partners on our own health situation. We'll be giving them health reports and our statistics. So those are the 4 phases of emergency management. And now I'm just going to talk very briefly about my role as the Emergency Management Director. And of course, most importantly, my job is to keep the community safe and healthy by maintaining primary services to the city, such as police, fire, DPW, Board of Health, just to name a few. These are basic services that one would expect to receive even in the face of a crisis. And that leads me to one of my very last issues, which is probably the most important issue at this point, and that's continuity of operations within our city government. I know Mr. Hogan is going to talk about this in further detail. Each mission-critical department in our city has a line of succession that ensures someone will always be in charge. The mayor's office, payroll, police, fire, Board of Health, and the DPW all have standard operating procedures that address these lines of succession. Its purpose is to ensure that essential functions of city government continue on unhindered. It addresses transfer of authority when key personnel are unavailable. All essential city departments have very recently updated their continuity of operation plans. So in closing, and I said this to the City Council this past Tuesday night, we can't predict the path that COVID-19 is going to take here in Malden, but we have trained and we are prepared for it. So with that, I'm happy to answer any questions anybody might have.
Thank you, Director Cronin. Now let's hear from Mr. Hogan about the continuity of local government.
Good evening. As the mayor mentioned, my name is Ron Hogan. I'm not only the city's parking director, but been actively involved over the last few days in trying to arrange for a situation here at City Hall where we've been able to close down our buildings to public access and have our staff working remotely from home, while at the same time making sure that each department is able to continue delivering critical city services so that for however long this goes on for, those critical things that need to happen on a day-to-day basis are still happening. So we've worked together with all the department heads to outline, again, those critical service delivery things that will be accomplished remotely, albeit maybe not quite as timely as they would have been with a direct visit to the office. And our communications director, Ron Cochran, has published on the website those things that you should expect to be able to still get from us during those period of time, and those things that we've considered to be non-critical as we go through this period of trying to make sure that we don't add to the spread of this virus across the state. So I'm happy to answer any questions about anything specific. There's a lot out there on the website that tells you that, for example, in the city clerk's office, if you're looking for a copy of a birth certificate, you're going to still be able to get it, but we'll be doing it in a different means than what we might do otherwise. And we've gone department by department and trying to outline that. So happy to take any specific questions about anything you're really wondering about over the course of the next hour or so.
Great. Thank you. Now Ms. Hayes will talk about community outreach.
Hi, good evening. Just want to say first and foremost that I hope your family and your loved ones and everyone's taking care of one another and that you're all staying healthy. The senior center was one of the first buildings that we closed, or the programming for seniors, because they are our most vulnerable population. So I'll just give you a brief update of what we've done, and then I'll just take questions after, because I'm sure there's tons of them. So what we did was we went to first-line phone calls, so we called every instructor and every program leader that we had here, and then they in turn called their seniors to let them know that we were programming until further notice was canceled. We have a Facebook page, and we keep that updated with new announcements, and put signs up on the doors, and contacted Mystic Valley Elder Services and Steve Finn. We were working with the director of Malden Housing Authority. So we've really been working together in trying to get the word out as best we can. And our phones are operating. As of today, Cheryl Spinella has been answering our phones, and the good news is no one called, but we expect that that would change, and we're going to be answering our phones for working hours and off working hours as much as possible, and emails, so if anybody has any questions. As far as the community goes, I have to say that it's been a tremendous outpouring from our community offering help and how, they can volunteer and what they can do to help out in the situation. So what I've been telling people is to hang tight. We don't want to just have a ton of volunteers, and we aren't organized for it. So we're trying to get things organized in the background, and then we'll put the word out and hopefully have a systematic way of contacting seniors, homeless, and the rest of our population that's isolated.
Okay, great, thank you.
Oh, the summer youth employment program too, just so you know, any youth out there, we did cancel all interviews, but we're still actually extending our application process. So just keep filling them out online, and we'll get back to you.
Okay. Now we're going to hear from Senator Lewis, who I just spoke with this morning about a question that came in, and it might be here tonight as well, about the impact this is having on people being able to make rent and mortgage payments. So our senator is here tonight. Thank you for joining us.
Well, thank you, Mayor Christensen, for your strong leadership in these unprecedented times, and thank you to your team and everyone who is stepping up to do their part as we work our way through this crisis. I want to particularly thank our medical personnel and our first responders and our just everyday residents who, as the mayor described when he opened up this Facebook Live, are going out of their way to help each other and support our neighbors and those in need. Our state delegation is coordinating closely with our city officials, and also are in close touch with our federal delegation as well, because it's, everyone recognizes it's imperative that all levels of government are working very closely together as we move through this, the city government, state government, and federal government. From the perspective of our state government, the Baker administration and the state legislature, we are approaching dealing with this outbreak with two main strategies. The first is basically to deal with the virus itself, and of course that involves education about what's happening and how to protect yourself and your family, social distancing, of course, although now we're using the term more frequently, physical distancing, prevention, testing, treatment, and of course making sure we're supporting our healthcare providers, our hospitals, and our first responders so they can do the job that they're so well trained to do. And then the second main strategy is all of the ramifications of what this virus is doing to our communities and our economy. So the impact on families, on workers, on seniors, on businesses, particularly small businesses, and nonprofits, and our municipalities. So considering all of those issues and what we need to do to provide assistance. Finally, within the state Senate, we've created an emergency task force, which I'm a member of. We are coordinating closely with our House colleagues and with Governor Baker and his team. And some of the actions that already have been taken include an emergency fund of $15 million, which has been released. Most of that money is going to our local public health folks to help them, but some of that will be made available for other emergency purposes. We're also, later this week, are going to take action to expand unemployment insurance. So for those who are, being laid off or furloughed or cannot open their business, there will be expanded and immediate access to unemployment insurance benefits. So we are also looking at taking action in the next week or two on a range of other issues to help our municipalities, to deal with local elections, to help prevent foreclosures and evictions, which is what the mayor brought up a moment ago, and numerous other ways to make sure we're fighting this pandemic with every tool we can at the state level, the local level, and also relying heavily, of course, on action at the federal level. So thank you.
Thank you. And finally, we're going to hear from our school superintendent, John O'Teary.
Thank you very much, Mayor Christensen. It's an honor to work with these colleagues across the city. I just want to say that we have been on top and been very proactive with the flu and then coronavirus throughout the year, with giving our families a lot of information around when to keep their children home. We had plenty of hand sanitizer on the way, and when the pandemic started to come to our shore, we began constant communication with Board of Health Director Chris Webb. We also have worked very closely with the city's emergency management team and Glenn Cronin. That has included Chris Webb as well as the city nurse, Maria Tamagna. We continue to stay in multiple times a day contact with the Board of Health and the emergency management team. Last Thursday afternoon, we made the decision, which I know was the correct decision. Very few school districts did close indefinitely like we did. And part of that was because when Chris Webb and I were talking about what would be a safe time to return, we didn't know. And in good conscience and good faith, we could not put out an arbitrary date and say that it would be fine at that point. So we've been out since March 13th. We had a professional development day scheduled then. We are working with, our first priority was to make sure we could get our students fed, who are, many of whom are on a free and reduced lunch. We know food insecurity is a major issue, not only in Malden, but across the Commonwealth. So we set up a free breakfast and lunch, and I want to make sure that that gets out there multiple times tonight. We are combining the breakfast and lunch. You can pick up both meals from 10 to 1 at the Salem Wood School and at Malden High School. To keep our physical distancing, we have arranged for a drive-through where you can take your car in the loop at the Salem Wood School, and on the Prescott Street side, that's the parking lot between the high school and CVS. You can drive in and we will deliver the food to your passenger side. We're really trying to minimize our physical contact and touches. That is from 10 to 1. You can pick up both meals, breakfast and lunch. We had a little low attendance on yesterday. Today was much better, and we're anticipating this will really increase. This is for any student who lives in Malden, any pre-K through high school student that lives in Malden. So those of whom attend Mystic Valley Charter that live in Malden, or Malden Catholic, or Chevron, or another school, this is really geared to help them. We hope that families take advantage of this. We've got a lot of communication. I've been on a number of conference calls with the Commissioner of Education over the last couple of days, and we have several more scheduled. This is a fluid situation. On Sunday, the governor closed all schools, private and public, in the Commonwealth until April 6th. They will reopen April 7th, but again, that's subject to change because we are in the middle of a pandemic and it's a very fluid situation. We will keep our community, our students and staff as updated as possible. I just want also to reiterate that every decision we make here at the Malden Public Schools, and I have a phenomenal administrative team that supports us, is in the best interest of our students first and our staff, and then our community. And we will continue to use that as our decision-making strategy, working closely with our community partners. Thank you.
And then I would like to also speak. This is Ron Cochran, Communications Director. I am behind the camera working on getting your questions answered. And just a few ground rules, if you could please, as you are typing your questions in, please restrict them to questions as opposed to commenting inside this thread, because it makes it really difficult to scan down and look at the important questions. The second thing is, it is almost guaranteed that we will not get to every question. However, we will be monitoring all questions, and we will definitely respond to each and every one as soon as possible. So at the conclusion of this, we will review all the questions and get back to you. I think we're going to start off with the number one question, and that is whether or not, or what is the current status of number of cases in Malden, and then what is the process if somebody was to be tested?
Okay, let's go to Director Webb. Just turn the mic on, Mr. Webb.
I'm sorry. There are 59 cases in the city of Malden right now. Of those 59 cases, there's 57 presumptive cases and 2 positive test cases. How they get tested is each individual, if they're having symptoms, must go to either an emergency room, urgent care center, or their primary care physician. At that point, they'll be diagnosed and triaged in a way that they'll be looking for certain criteria to meet for the next level of testing. If you meet the next level of testing, you will get a swab and it will be sent off to the state lab for a test. It's taking about 48 hours to get those test results back right now, but it's a pretty quick test. With all things going on, it's a pretty quick test. That's really the only way anybody's being tested right now.
And what's the future of testing? I see some information has come down recently. Is it going to be quicker? If so, how?
I'm optimistic that the federal government is going to fund the drive-through swabbing session, which is really something we drilled on, so we're hopeful that's what happens.
When could we see that?
I would think in a month.
Okay.
It's going to take that long to get the tests out, if not maybe a little longer, but somewhere around there.
Okay, and if someone has further questions based on what you just said, what's the way to reach you? What's the phone number and email address?
Best way to reach us is 781-397-7049. And my email is cwebb, W-E-B-B, @cityofmalden.org.
Okay, great.
Sure.
Hi, I'm sorry. So just to add to that, I did get some information from CHA, Cambridge Health Alliance, actually about an hour ago, that they're going to be launching a drive-through testing tent beginning Wednesday, March 18th. The service will be offered to CHA patients from 9 a.m. to 3 p.m., 7 days a week until further notice. And you might want to check out their website just to keep in touch with that.
And what's the website address?
I believe it's
.org.
.org.
Okay.
Okay, our next question has to do with daycares, and the question is whether or not daycares are going to be closed, is going to be forced closure.
Yeah, we have received a number of questions on that, and we had been anticipating that the state was going to speak to it, but they have not as of yet, so I don't know if the senator can provide an update. I know Mr. Webb has been looking into the issue, but what I can tell the community is if they do not, in a very short period of time, we will look to take action ourselves. So let's first hear from Senator Lewis as to whether or not a decision is coming as to whether or not this protocols will extend, beyond what was announced Sunday night. And if they are, when do you think they will happen? And then we'll go over to Mr. Webb. If they do not happen, what our game plan is on that.
So, thank you, Mr. Mayor. So, no decision has been made yet at the state level by the governor in terms of whether to order all childcare, daycare, early ed providers to close. However, since the decision was made on Sunday evening to close, as the Superintendent Terry said, close all of our public schools, public and private schools for the next 3 weeks, Obviously, it is a reasonable question to ask. How can it be safe to continue to keep all of our daycares, childcares open? The very big concern we have is that we want to make sure that our medical personnel and our first responders and other essential workers can still do their jobs, which means there needs to be appropriate, safe childcare. So what is happening right now, I was on the phone with the Commissioner of Early Education this morning, and what is happening is they are drawing up emergency regulations that will enable a certain number of childcare providers, either existing providers or potentially new providers, like in a school or a hospital, to be able to be open to serve those people, those individuals who have to do essential jobs and therefore cannot do it without childcare. So that is being done in anticipation of the very real possibility, although again, a decision hasn't been made yet at the state level, but a very real possibility that in the near future, the governor may follow the order he gave for K through 12 schools and also carry that over to early ed providers.
Yeah, and I know, Senator, we've had questions about hair, nail salons, other types of retail businesses. Is that separate from what you're talking about? Has there been any talk about going beyond, as I said?
So my answer was just specifically
Right.
with regards to child care, early ed providers, you know, YMCA programs,
Right.
Boys and Girls Clubs, and so on. There are definitely being very legitimate, reasonable issues raised relative to all kinds of other providers, like the mayor mentioned.
Right.
And I think right now, again, the no decision's been made at the state level. You know, the governor has the power under the state of emergency to take action, but no decision's been made yet on these other kinds of businesses. But again, you know, this is a very fast-moving situation. I think it is certainly very possible in the near future, you know, we could see further action taken in the interest of public health and social
And you would
distancing.
understand if we did that on our
And
own?
municipalities, Malden, obviously, other communities have the power under your local Board of Health to take those kinds of steps, and you know, I wouldn't be surprised to see that start to happen. Although I think we would all agree it would be better if it was a consistent,
For
you know,
sure.
clear statewide.
I think that's why
approach.
we've been holding off, is to
Yeah.
see whether or not that was going to happen, but, you know, we may do it ourselves. So let me turn it over to Director Webb, who we have been talking about this pretty much throughout the day.
As far as daycare centers go, I just want to let the community know, too, that there are a lot of daycare centers that have closed. So the squeeze is on. I'm hopeful that some of them will be able to open with a smaller classroom if they have a demand. And the state has been kind enough to ensure their vouchers, so that's a good thing. So there'll be daycare centers when we come back, so that's important. As far as what we're calling right now non-essential services, which would be barbershops, hair salons, nail salons, and the like, there's that social distancing aspect that is not possible when you're having those procedures done. So it's my opinion, and I'm going to have the Board of Health meet tomorrow to discuss it further, but it's my opinion that those services should be curtailed as well.
Right.
It doesn't serve anybody's purpose to be that close to anybody right now, and if it's good for the rest of us, it may as well be good for those people as well, and especially our seniors who, we all know, like to go to the hairdresser, so
Right.
we want to protect them.
Right. So for that question, watch over the next, I'd say 24 hours for some direction from within our community, because again, I think the senator outlined that they're talking about it, but I'm not sure we want to wait any further. So we think we'll, you know, speak to that in the next 24 hours, and we'll make sure to let the city know what we're thinking. Next question.
Okay, the next question for the panel, and it was also, there's some feedback that maybe my mic is low, so you may want to repeat the question for the benefit of those listening at home. But the next question is in regards to, first we'll talk about parks, whether or not parks are open, and then the next question is from Councilor Steve Winslow, and he wants to know if there's a policy for accessing senior housing.
Okay, so the first question about parks, I think Mr. Cronin or Mr. Webb want to speak to that? Mr. Webb, we'll go to him on the question about whether or not our parks remain open during this crisis. And then we'll go to Ms. Hayes on the question about senior housing and where it stands during this. So, Mr. Webb.
The answer to the question is yes, the parks are open, but not for congregant, not to meeting sites and not for socialization, but for fresh air, walk the dog, get your exercise in, keep your physical distance as you should at all times. Do not let up on that. You don't know who you're going to be talking to, and they may not know they're infected. So be watchful of that. What we really want people to do is use the parks as a passive recreational source. No organized sports, no shirts against skins, none of that. That's definitely off the table for the time being. But, and please don't use the playground slides until we know that we've had enough time to get back in there and sanitize them.
So that's in effect now, and I'd be remiss if I didn't mention our police chief, Kevin Mullis, was here, and I know he's been traveling around with Director Cronin to check out the parks, along with our rec director, Joe Levine, and Public Works Director, Bob Knox. So let's go to the question about whether or not, I think it was senior housing being accessible right now. Just turn the mic on.
Right, sorry. So this is a letter that we received from the Executive Director, Steve Finn, that the Malden housing, all the offices are closed, but they are answering their phones, and you can reach out to them by phone or email. All of the buildings, obviously, where people live, they're still functioning. They're taking all the precautions, so hand washing, cleaning, sanitizing, everything. As far as filling out new applications, I would assume, since the offices are closed, that that's not happening right now unless you call them and ask them directly. You could mail in an application. But for now, all their buildings are fully functioning, and they are following all the protocols
What's
given
the
down.
best way to reach them?
You can reach them. Let's see. It's they're at 630 Salem Street, and it's 781-322-3150. And this is translated into a couple of different languages, it looks like, on their website. So you can go to their website at maldenhousingauthority.org and check that out.
Okay, next question. What is it? I guess, yep.
So as far as the senior care facilities in Malden, we've reached out, the emergency management team has reached out to the Forest Hill Park Senior Living, the Atria, the Dexter House, the Davenport. They're following all the guidelines that they've received from the Department of Public Health, including no visitors. Exempted visitors have to wash their hands as soon as they get into the building. They're following all the protocols. And if anybody's looking for more information on how seniors can protect themselves, they can go to usa.gov as well, and they'll find a lot of information in there.
All right, thank you.
Okay, the next question is whether or not if the state government decides that it does not want to do a shelter-in-place situation, could the city then issue its own shelter-in-place order, essentially overriding what the state's not doing?
All right, so the question is, will the state declare shelter-in-place across the Commonwealth? And if not, whether or not we have the ability to do so, and if so, are we considering it? So let's first hear from our state senator as to whether or not that is being discussed at the state level, and then we'll travel over to Mr. Webb to get his thoughts on whether we can do it locally.
So the short answer is no, not at this time. I think the governor's view and there's different opinions, of course, depending on who you talk to, but the governor's view is we've taken some very strong steps at this point, certainly probably stronger than most other states, and that's, but we are following, as the governor has said, we're following the facts on the ground literally every hour. So there's no plan yet, no plan at this time at the state level. It does not preclude cities from taking further action, though.
Okay, so as the senator said, do we have the authority, and if so, what's your thoughts along with Director Cronin as to whether or not that's something we need to consider?
Well, right now, it's definitely being discussed with the Board of Health. Whether we'll get there or not is a question I'm going to have for them tomorrow. I think we're going to be looking at the infection rate as it goes over time. Are we getting higher infection rates than we started with, and we are creeping up a little bit. Middlesex County has the most cases, so we need to be ever vigilant. But we do have the authority to do that, yes. The quick answer is yes, we do. But there's a lot of factors that will go into that decision.
And you're not considering it today?
We're going to have a quick discussion about that tomorrow at the emergency meeting that we're having at 2:30. I would think that they'd probably want to see a little more information on the infection rate before they make that decision.
Director Cronin?
Yes, I mean, I can only speak from, the emergency management
Yep.
and the police department side. If we had somebody that we were looking to quarantine, and this person, say, wasn't being cooperative, under the community caretaking doctrine, and also to the Board of Health, we could get a court order to quarantine that person. And even without that, and if we didn't have time for that, we do have the ability as a police department to use that authority to detain that person until we can reach out.
And just so people at home, exactly what does it mean, a lockdown? What would that entail?
Well, I mean, if we're talking about sort of a martial law type situation, there would be nobody on the streets. There would be nobody in all businesses would be closed.
Okay.
Commerce would actually stop within the city at that point. Nobody would be allowed outside.
Okay.
Mr. Mayor, can I add one more point?
Yep.
So obviously, as Chris Webb said, a lot depends on what happens with the virus and that. But another factor I think that's very important in making the decision at the city level and certainly at the state level is the behavior of all of us. If we are all observing, keeping our physical distance and not gathering, following all of the existing, not just what is required, but also what's being recommended, then it makes it less likely we have to take further action.
Yeah, what we heard on our call with the Metro Mayors on Sunday night was the next 4 weeks are really, really important. So if we do follow the protocols that have been outlined, fingers crossed, things will start to churn. But if we don't do that, we don't want to talk about that. But let's take some more questions. I want to try and get as many people in as we can.
Okay, our next question is for the senator, and the question is a two-part question, and both about assistance. The first is for renters' assistance, and whether or not there is protection or assistance for renters, and whether or not there's any protection from eviction based off of what's happening. And then the second part is whether or not there's going to be any accelerated unemployment benefit process that's going to be made available.
And do you need that repeated here, Ron, or is... So the question was, for those watching, was around rent, as to whether or not the state will step in, and then it was about accelerating unemployment insurance benefits if required. Senator?
Okay, yes, so these are really important questions, of course, and a lot of people are concerned about, paying their bills in a time like this. So first, in terms of evictions and paying rent, this also would apply to mortgages and foreclosures. The housing court is essentially shut down and is not processing evictions or foreclosures, so that would be on hold, and I believe until at least April 21, although likely will be past that. So that's already in place right now. And then in addition to that, the legislature is definitely considering emergency legislation that would basically prohibit any evictions or foreclosures during the state of emergency. So that is very high on our list of something that we need to do to protect people. So the last thing we want is somebody to be out on the street in this time. And then in terms of the second question about unemployment insurance, we're also very concerned about what happens if somebody is not able to work because they've been laid off, or they're not able to work for illness or caring for a loved one. So we are taking action. This week, the legislature will pass emergency legislation either tomorrow or Thursday that will provide immediate access to unemployment benefits with no waiting period, because currently there is a waiting period, but that would do away with that. And we also are looking at other ways to expand access to unemployment insurance. In fact, I believe the governor, using his existing power, has already waived some of the requirements, like job search requirements, things like that. So that is already. So the goal here is to make unemployment insurance readily available to those who need it, who otherwise would not have a source of income.
Okay, great.
Okay, our next question is for the superintendent, and the question is whether or not ELC payments will continue, or whether or not that will be discontinued. The second question is in regards to, is there any plan for a distance learning initiative? And then the third question is in regards to the lunches, whether or not lunches could be picked up on behalf of somebody else. So I'll go to the superintendent on that.
Sure, thank you. Those are three great questions. Let me take the first one of the ELC payments. Those have been discontinued. We are not taking those payments at this point because we are out of school for at least the 3 weeks. In terms of the lunch pickup, we are encouraging people to come and pick up for others to sort of minimize that exposure out in the public. Just provide the name and the grade of the student in Malden that you're picking up for. We hopefully it's a parent or a guardian, but yes, we can have somebody pick up breakfast and lunch, and they'll be packaged together, wrapped individually, both breakfast and lunch. So 10 to 1 again at the Salem Wood School and at Malden High School. There's a drive-through option at both sites. We're really happy about that, as well as they can come into the cafeteria, pick it up, and exit through the cafeteria. Due to restrictions, we are not permitting anybody to eat on site. So these are grab and go meals, very similar to what is provided in the summer. In terms of distance learning, we are going to be providing enrichment, and really these are non-school days, so there's only an expectation of a continuation of learning. The commissioner has been very clear that we are looking at ways to keep our students engaged, much like we would over a prolonged summer vacation, with reading lists and some activities to reinforce already learned materials. There should be no teaching of new materials or completing of assignments that are to be graded. Teachers should not be assigning, and they will not be assigning, any new work with an expectation that students complete this for grade or extra credit. In the next day or two, we will be releasing a list of enrichment and engagement links and activities for our families and our students to access. We are in the process of compiling that so that it comes from the district, that it is uniform, and that it is all vetted. The commissioner's office and will be very instrumental in this. They have been very good with some of the community partners, including WGBH, who is giving us access to all of their online learning activities, as well as potentially releasing time during their broadcast day to do some activities for families that do not have internet or devices at home. So we'll be putting that out as soon as we get that completed, and as soon as we have more solid information on that.
Okay, our next question is in regards to, if there was a decision to shelter in place, how would people move freely to grocery stores, pharmacies, work, etc.?
Mr. Webb, Mr. Cronin? Mr. Cronin?
That's a very good question. I think at that point, there may be some exceptions that will be created in the law to allow people, of course, we have to have food. So my answer to that is there will be some sort of exemption put in place. We just can't have everybody locked down and then expect everybody to survive without food and water. So I think something would be put in place if we do get to that point.
Is that something that the team is looking at, or we're not close to being there yet?
I don't think we're at that point yet. That
Okay.
we're not talking about that yet.
Okay.
But
Mr. Webb, you want to add to it?
Yeah, we're not there yet, but if we were to get to that point, we would probably have, we're lucky in that we have 3 supermarkets, so we'd probably ask people to go to the one closest to them during limited hours, of course, nothing at night, and that way, there'd be shorter lines, inside and out, and there'd be fewer people allowed in. So we'd have to come up with a system that people would know where they could go and when, but with 3 supermarkets is a luxury.
Okay.
So.
All right, thank you.
Okay, we do want to remind everyone again, we know people are anxiously asking a lot of questions. Again, we have, just to give everybody an idea of our attendance for this particular meeting, we're at almost 300 attendees, and the questions are numerous. And again, we will make every effort after this to respond to all questions. One question that did come in back to our superintendent was with respect to whether or not there would have to be a makeup of these days, you know, depending on when they were to come back. So I will go to the superintendent on that.
Sure, that's a great question. We get this all the time. So last week, the commissioner exempted schools from going beyond their 185th day. So no matter how long we're out, what was scheduled as the 185th day in our district would be our last day. In Malden, that is June 19th. We had one snow day in December. So we have 4 left on our what we budgeted for the 185th day. So at this point, the latest we will be going, despite the fact that we're going to be out for at least 15 school days with the coronavirus, will be June 19th. If that changes, and we don't anticipate it will, the commissioner has been very steadfast on that. That will be the last day of school in Malden.
Thank you. Okay, our next question.
Okay, the next question is whether or not there is a plan to have any easing on parking regulations during this time. And then there was another question in regards to questions and summaries. Our intention is at the conclusion of this video, we're going to go in and summarize all the topics and try to put minute markers on where they're talked about, and then keep the Facebook Live video going so people can come back to this and reference it relatively easily. But again, we will answer all these questions in line in the thread.
Okay, the question was relative to parking restrictions during this crisis, and I know Mr. Hogan and his team have been working on this. So what you thinking there, Ron?
So I would tell you that we have relaxed most parking restrictions across the city. We do have a skeleton crew on just trying to be there to respond to those things that are more of a public safety nature. We do recognize that across the city there are people who are home that are parking on the streets that wouldn't normally be, and oftentimes that might be in a permit area. And we also recognize in the downtown area there's a different dynamic. So the short answer is we are not enforcing the vast majority of parking restrictions across the city, but are also trying to have staff out there to deal with those things where, you know, if a resident happens to have their driveway blocked, or we find a fire hydrant blocked, a handicap ramp, things along those lines. So we'll continue to monitor to try to make sure that it doesn't get to the point where it becomes a problem for our residents, but most things we are not enforcing at this time.
And Ron, what do you want people to call or email if they have a question about it?
Yeah, so you can reach us anytime, 781-397-7196. We'll be answering that phone day and night, and you can also email us. You can send it to ardolino, ARDOLINO, at cityofmalden.org. And again, we are responding morning and night.
Okay, great, thank you.
Okay, there have been several questions about the waiving of city fees and different things along those lines, and I think the way our approach to that would be we're going to try to summarize all those questions and find answers for them, specifically with the department heads, and then again, we will respond in line after the fact.
All right, so let's Mr. Hogan and I have been talking about that. So I know we're getting that question now, right? And which a lot of it is state controlled?
So what kind of fees are we talking about? I guess
Excise, you're talking?
Local. Yeah, online fees.
Oh, to
such
pay a
as,
bill.
You know, invoice cloud fees.
Yeah,
things
so
like
so
that.
remember, there are no invoice cloud fees if you pay a bill through electronic check. The fees, if you're using a credit card, is a third-party fee that we are not able to control. But
Gotcha.
any bill can be paid online using an electronic check, and what that essentially means is putting in the account number and the routing number off of your check, and there is no fee. We waived that several years ago to try to get more and more people utilizing that.
Okay. But the credit card, we have no control over. That's
Yeah,
third
it's a
party.
third-party processor, yeah.
Okay, this next question is, what is our response to our homeless population and keeping them safe during this time?
Okay, Ms. Hayes? Just turn your mic on, Ms. Hayes.
Sorry, okay. So right now, because the Malden Warming Center has been closed, we're trying to locate and try and stay active to where these people are. It's kind of difficult, but I have relationships with some of them. So for our seniors, they have been showing up here actually, and I've been talking to them personally, and word of mouth is usually the best way to get information out. So ABCD is still functioning. They are still, their services out there. We're actually working with a couple of people right now on our homeless population. And we would do whatever we would do normally, which would be to call, find out the situation, and then work with our departments and the Board of Health to put them up in a shelter, in a hotel, if that's what is needed now. But unfortunately, there's not too many services out there, but we are working hard to be in touch with them. And we have seen them, like I said, a couple of times they have showed up here, and we're working with them.
Thank you.
Okay, our next question is, I believe, to our emergency management director, and that is there any resource available to assist with the basic devices and things such as, masks and sanitizer and things like that for our elderly population or anyone who is in need? Is there a plan for those supplies?
And do you recommend? I mean, that's been a question, I think, during the crisis, whether or not everybody should be wearing a mask. What's your thoughts on that?
Right, well, and I think it's been, put out there that people who are healthy and they're in the public should not be wearing masks. Masks should be for people who are sick, and for, first responders to use. And that's one of the reasons that we're running out of masks. So many people are wearing them, they're walking in the street, but experience has shown that that doesn't stop them from getting ill, having a mask on like that, walking in the street. So just today, I think Director Webb is putting a request in for some equipment for, first responders in our city. I know for the Board of Health. So I haven't had many requests from any of the senior care facilities in Malden in regards to that. But I did call every one of them and offer our services. I gave them all the contact information. Great. So if they need something from us, they'll call.
Okay. Do you want to add anything, or are you good, Mr. Webb?
Just one thing that I'm sorry, I forgot my train of thought.
About masks?
The masks, yes. The state has come out with $15 million for local health departments to access. The budget will be set tomorrow afternoon, and we'll submit that. So we have police, fire, we'll have schools, human services. Give us their information. We'll do the legwork on the math, and we're going to submit that tomorrow. Okay. By close of business. It's going to be a large number. Okay. And we're hopeful that manufacturers have turned that corner and they can now meet the demand. We just don't know where that is yet.
Okay. Thank you.
So we want to cite, there's a few people that are saying thank you to our first responders for continuing in our emergency department, for continuing to provide this services, and thanking the leadership for stepping up on these times. So we'd like to say you're welcome and thank you back for residents being patient with us. But the question is how this may impact other non-COVID-19 related medical issues that somebody might have, response, ambulance, fire, et cetera, et cetera.
Okay. Mr. Cronin? Mr. Webb first, and then Mr. Cronin.
From all the meetings that we've had with Cataldo Ambulance and the fire department and police department, it should affect it in no way, shape, or form. They have a sufficient gear to get to anybody who may be sick, and they have the universal precaution training to handle the call. So they should be virtually seamless, unless there's some obstacle that unrelated to the disease that would slow them down.
Okay. And I can tell you that we met with the fire department and Cataldo Ambulance this morning to discuss this. Cataldo has a 4-phase plan that they'll be putting into effect soon, which should provide plenty of coverage for our area and their other areas of coverage. And what that will look like is sort of what the police use as mutual aid. the ambulance companies will be helping each other out. So we could even, one of the scenarios was pointed out that we could have Boston EMS responding here for medical aids. We don't think we're going to get to that point, but we're ready if it does. And it won't increase the response time by that much. They're going to have ambulances pre-positioned on city lines, borders, so it'll make the response faster.
Great. Now, on behalf of the panel, we just want to join our community in saying thank you to Police, Fire, and Cataldo. I know you've been working hand in hand with them. Just as recent as today or yesterday, you were meeting on protocols upon which responding officers would be safe when responding during this critical time. So thank you.
You're welcome.
Okay, just before we go to the next question, just a couple of things. We are now at 7 p.m., which is when we said we would stop our broadcast. And
Keep going.
We would like to keep it going according to the mayor's request, which is great. Just want to remind everyone that the information about COVID-19 that is available on the city's website, we've been trying to keep it as up-to-date as possible. What we're doing is keeping information that affects Malden residents only on there. We do have links to CDC and statewide efforts, but we're trying to keep it local. So if you have any questions about what city services are open or closed, businesses that are closing, daycares that are closing, things like that, we're updating it, by pretty much by the hour. So if you find anything is mistaken or if you need us to update something, please email us at info@cityofmalden.org. Okay, the next question is in regards to trash pickup, whether or not there will be any delays at all in that particular city service.
No. As scheduled. And there hasn't been anything you've heard, right? Still good? No. Mr. Carger, you should plug tomorrow night's forum, I believe, speaking of solid waste collection, about the change that is on its way about recyclables starting April 6th. So if you want to plug that, might be a good time to do it.
I'll gather that info and I'll, as soon as we come back, so
Okay.
I'll get that. We may have a problem in our program right now because we look like we might be hung. So it cuts off. I believe it might cut us off. Okay, it looks like we may have had a technical difficulty, so we'd just like to have everyone bear with us for a second. I believe we are back online now. We may want to readdress the last question asked about trash and then talk about that, whether or not there was a disruption in any trash pickup.
Nope, there will not be.
Okay. We are going to be back here tomorrow night to have a forum that has nothing to do with COVID-19, which is probably a relief to some. And that is, we are going to be reviewing our recycling efforts. As of April 6th, JRM will be strictly enforcing our recycling policies with respect to contaminated recycling. And we are aiming to have a forum tomorrow, right back here on Facebook Live, that addresses some of the questions, concerns about proper recycling. And we will have Director Knox as well as the trash inspector, Steve Prince. The mayor will join us. I will be here as well. And we will discuss all things related to proper recycling. As, again, we know we have a significant distraction here, but that reality is coming our way. We simply must educate our residents on proper recycling techniques. So we will be doing that as of tomorrow night. So please join us here tomorrow, facebook.com/City of Malden, and we will be discussing and taking your questions. One last thing is that we are going to try to keep that forum specific to that topic. We are trying to keep it laser focused because we understand people have your concerns about other issues, but we do want to keep it just to that topic. Okay, the next question we're going to have is for our superintendent, and the question is, what is the school's response? what about the school's ability to respond to an emergency? So I'm guessing what they're saying is, if the students are allowed back, would there be, continuous monitoring of this effort after the fact? And we'll go to the superintendent.
Sure, that's a good question. Before the students came back, I would expect we would have a meeting with our emergency management team, along with our nursing program, our administrators, to go over what the protocol will be. We would certainly follow the guidelines of our local, our Board of Health and Mr. Webb, as well as the state and the CDC around that. So we would be just like we were prior to us going out on this closure, hypervigilant. Anybody who's sick, we would strongly encourage our families to keep those students home. And I think when we're in the middle of this thing right now, we would be ever hypervigilant on this going forward. So, we've got a tremendous nursing staff led by a director of nursing, Patty Tremendozzi. She has also been a part of meeting regularly with the city's nurse, as well as in contact with Mr. Webb. So we feel that going forward, when we come back, we would set together a plan that would address this. But I suspect that while we're on a heightened alert right now, we would not be returning back to school until really the all clear signal has been given statewide and certainly here within the city.
Okay, our next question, we'd like to go back to Karen Hayes on this one. There was a question about, we use the acronym CHA, so they weren't sure what that was, but we're going to go back to the testing question. There are actually some healthcare professionals in the thread who've responded as well, but the question is about whether or not testing is available through their own primary care, or is there an intention for testing to occur by an entity, for the public in general?
Is that for Mr. Webb or?
I believe it's to both Karen and Mr. Webb.
Let's start with Mr. Webb, Ms. Hayes. Because yours was relative to CHA, right? Cambridge Health Alliance?
Yeah, that's what I thought the question was, but go
Yeah.
ahead.
I'm sorry, I'm losing track of the question. I'm going to write them down from now on, but
Question is about testing citywide. If this
Yeah.
is going to occur, who will it be through? Walgreens, CVS?
I
Will it
believe-
be- Do you have to go through your primary care? Can you
Right.
just roll up to CVS and get a test?
right now, you have to go through a primary care physician or a doctor in an urgent care or a medical setting. That has to happen. Your test won't go any further than that if you don't go. So the primary care physicians right now are, not everybody gets a test because their primary care physician says so. There's protocol at the state level, and depending on whom they're testing and if they have a cluster and how many test kits they have on hand will determine that. That's kind of the way it's going right now. The state has accredited another lab to help them. So they're up from 200 tests a week to 400 a week. So that's a huge, it doesn't sound like a lot, but it is a big hurdle that they overcome, and there'll be more of those labs opening. It's just an accreditation issue. They've got to be able to, handle the lab work and make sure they're not getting false positives.
Okay. Ms. Hayes?
Okay, so CHA stands for Cambridge Health Alliance, and they just sent me an update of all of their procedures and things that they're offering, which will be on their website, cambridgehealthalliance.org. And this, just to be clear, is for the testing that I was talking about, drive-by testing, is for Cambridge Health Alliance patients only right now. And you could call their office and schedule one. Everything goes through their nurse triage line at 617-665-1977. And if I could just quickly go back to something that I've been wanting to say here, because I don't want any confusion about the YMCA and YWCA. As of right now, their childcare is open for people that are already enrolled and use that for, and that's because of, essential employees who still have to work as of right now.
Thank you, Ms. Hayes. Senator, you want to add to this?
Just wanted to add, Mr. Mayor, around testing. while it is certainly the case that there was a delay in having enough tests available, this is just a local issue, this is around the country. The capacity is now expanding rapidly. As Mr. Webb said, the state lab, which has been doing the testing in Massachusetts, has doubled its capacity, and we've also brought online several, I think 3 now private labs that are certified by the FDA to do the tests. But all of that said, I think it's really important to re-emphasize that we really need our healthcare system to focus on those who are truly, ill and need help. And so, we don't, you don't want to be going to get a test unless you've already spoken to your healthcare provider and they've gone through a checklist of what your symptoms are, because people are still getting regular seasonal flu and colds and other things. It's not just, COVID-19. So really important to talk to your healthcare provider. They will check, what your symptoms are and determine if you should be having a test. In that case, you would then be authorized to have a test.
Okay, so we do want to give some time for the panel if they do want to say some closing remarks as we go around. We did get some feedback online here that our Director of Public Health perhaps looks tired, and I believe the name of the Facebook person may or may not have the last name Webb, so we don't know that for sure. But we do want to, again, offer the panel some time to do any closing remarks, and I believe we were going to ask Director Webb to go last so that he can summarize some protocols and kind of cover from there. So I'll leave that to the Mayor.
Okay, Senator?
Well, if any one person has the right to be tired at this point, it's Director Webb. So thank you so much to our local health folks, are on the front lines here. And good news, by the way, we also have legislation actually that I had filed that was in the queue already, but we're going to pass it this week, which is going to bring also additional support and resources and training to our local public health departments. It's probably not going to make a difference right now in this pandemic, but it is going to make a difference going forward, because this has reminded us how important public health is, and particularly local public health. So thank you for what you're doing. I just wanted to, there's been a number of mentions tonight of good resources. Please remember to only use authoritative, trusted sources for your information here. The city's website is one of those, the CDC, of course, and then I did want to make sure you know also about the mass.gov/COVID-19. mass.gov/COVID-19 is a great resource for lots of information about what's happening in our state and resources and latest news, so urge you to check that. And finally, anyone who has further questions that are not about city-specific services, please feel free to reach out to my office. The State House is closed to the public, but our office is still open for business, constituent services, and obviously working on legislation and other issues. So you can call us, you can email us, you can Facebook us. We're there for you, whatever you need. And again, everybody stay healthy, stay safe.
Okay, Ms. Hayes?
Thank you. So I just want to remind everybody that the city's website is being updated, and I sent Ron Cochran a list of a lot of our organizations locally that will be changing, so please check that out, because there are things there that can also help with social isolation that people are having anyway, especially our 65 plus population, which we do have one of the highest populations in the state for that. So make sure that you check that, because we have people offering services for free, some Tai Chi services. There are church services on there that you can go in and from Facebook Live, and they're doing things, virtually. So please check that out so you don't stay isolated. Call our number at 781-397-7144. We'll be answering it. If you need anything, we will point you in the right direction to where you need to go for that. We're going to be checking that frequently. So that's about it, and thank you all for coming out in the community and offering your volunteerism.
Okay, Mr. Hogan?
So again, I just want to reiterate, and I know it's not the most important thing here tonight. A lot of this is focused, as it rightfully should be, on sort of the state of the health side of this. But as sort of this reality becomes the norm over the course of the next couple of weeks and longer, there is a lot of information on the city's website about how to continue to be able to do some business with the government, with the local government, that you may find yourself needing to over the next several weeks. So we are trying to have it both ways: keep our staff and our employees out of the buildings, but keep the ball moving forward, if you will, on the city level. So I'd encourage folks to look out there. And I also just say, from a parking perspective, the question got asked earlier, we're certainly showing restraint. With that is going to be some inconvenience for residents who may at times feel like they've been victimized by that restraint, and we just ask that everybody be patient as we try to work through this.
Very good. Mr. Cronin?
So I just have a few points of general information. Back to that renter question. I know that the Department of Public Utilities has now implemented a moratorium on all gas and electric shutoffs until further notice. So there's one thing. The Registry of Motor Vehicles, if your license, your Class D or DM license has expired or is expiring between March 1st and April 30th, there is now a 60-day grace period attached to that. The MBTA has reduced its service schedule right now, so if you want to look at the schedule as it is, go to mbta.com to get that. And just one last thing, as far as our seniors are concerned, Stop and Shop has been gracious enough to open the store at 6 a.m. to 7:30 a.m. starting Thursday morning, so they can go in, and that's for seniors 60 and over.
Okay, great. And Superintendent O'Terry still on? Does he have closing?
Yes, thank you very much. It's a pleasure to be working with such a dedicated group of professionals who have the community's safety as their paramount focus. For our parents and guardians, look for the engagement enrichment links to help your students stay engaged and on top of things over the next couple weeks. Again, this is not additional work. It will not be graded. It's not counted. This is not online or virtual school like you are hearing from some of our higher education university partners. I also want to again put in a plug, remind our community of a free lunch and breakfast program that is from 10 to 1. It's at the Salemwood School and Malden High School. We have a drive-through at both places where you don't even have to get out of your car, and they will be delivered to the passenger side, again, to minimize contact and keep our physical distance. You can also come in and pick it up. These are grab and go. Each meal is bagged individually, breakfast and lunch. And again, 10 to 1 starting tomorrow, Salemwood School and Malden High School. We will be in constant communication with our Malden Public Schools community. Keep watching us through email and through Twitter at Malden Public, and I also send out a number of our messages through Connect Ed, which we do have the capability. It is broadcast in 5 languages. That's what the Connect Ed capability is for Malden. So we will continue to be in touch and monitor this situation. I think the word that we've heard, it's overused, but it's accurate. This is a very fluid situation. And it's just, again, to our Malden school community, please stay safe and stay healthy. Thank you.
Thank you, Superintendent. I did want to mention one thing, and that is we have been utilizing our website for all our updates. Some might be used to our Code Red system. We are intending on sending out a Code Red alert, which covers a wide range of our residents. However, it does not give us the same flexibility of frequent updates. So what we are asking our residents to do is go onto our website at cityofmalden.org and sign up for alerts. And please be in touch with anyone that you know that may have internet access challenges. And to alert them of these new bits of information that are coming. They are very helpful because our alerts are time-stamped, so you can follow along the entire thread and see the progress of where these alerts are. And they will be delivered to you directly via email or text message. Again, we will be making a Code Red call to summarize a lot of this and to let our residents know, but we do want to drive everyone to the front page of the website to grab those alerts.
Okay, Mr. Webb.
Well, before we close, I'd like to thank Captain Cronin, the whole police department, the entire fire department, and the school department. They've been incredible work partners on this, and, you know, you can't do it alone. I may look tired, but everybody's working just as hard as I am. That's a fact. And, of course, the administration has been incredible, absolutely incredible. This is unprecedented access, and I appreciate it. I would ask everybody just to understand one thing, if you know nothing else about this disease, is that it is 10 times more infectious than influenza. So what does that mean? It means generally that if you're not keeping that physical distance, you can be infected. Some people are carriers, some people, they'll never know they were ill, and, you know, they just should not be, we don't know who they are, so we don't want to be taking a lax approach as to how we interact with each other and over the next month, month and a half. Remember to wash your hands often, okay? Also, hand sanitizer is helpful, but it's not a be-all, end-all, so wash your hands up to the mid of your forearm if you can, and cover your cough. Sanitize surfaces repeatedly after each use. Watch the bathroom etiquette. Make sure that you're maintaining the bathroom. That is another transmission point. And look out for one another. Helps people out. It's going to be different than we're used to. And as Americans, we don't like to give up our civil liberties, and no one's asking you to. We're just asking you to be observant and to care about the person with you. Thank you.
Great. And lastly, let me just say, someone asked me this morning while getting a cup of coffee what I thought of all this. And I thought I'd never say this, but I said, bring back the nor'easter storms anytime. I have never seen anything like this. But what I have seen before is the efforts of our panelists, along with our businesses and along with our residents, on rising up to meet this challenge. And I know we are Malden, and we will get through this so long as we continue to work together. So on behalf of everyone gathered here this evening, stay healthy. We are going to be working on this as long as it takes to get us through it. And please stay in touch with us at www.cityofmalden.org. Thank you.